May 18th was HIV Vaccine Awareness Day. This annual observance is a day to recognize and thank all of those who are working together to find a safe and effective HIV vaccine. One of those is Brenda Larkin of the Vaccine Research Center, part of NIH's National Institute of Allergy and Infectious Diseases.
When looking at the statistics of HIV, we know that this is a global pandemic. And when thinking in the past of what vaccines have done, they've had a great public health benefit. It was a way of saving lives in the past, and I believe today we can still save lives if we can come up with a vaccine to prevent HIV infection.
We've seen that with other viral diseases in the past. For example, polio has been nearly eradicated as a result of the vaccine.
Dr. Catherine Kripke is the Assistant Director for the Vaccine Research Program at NIAID.
40 million people around the world are infected with HIV, and every year there are 4 million new infections. We can't treat people as fast as people are getting infected right now. We don't have the resources and the infrastructure to do that. Now, we're definitely supportive of developing more resources and infrastructure for treating people, but ultimately the way to end the epidemic is by developing a vaccine.
Between the science that is going on the NIH campus at the Vaccine Research Center, and the public's involvement is how we're going to get to effective HIV vaccines.
An effort to encourage public involvement is the Be the Generation campaign, including information, brochures, and public service announcements.
Every generation has its great cause.
Mine was civil rights.
Mine was a better life for my family.
Mine was starting the fight against AIDS.
Ours is ending AIDS by finding a vaccine. A vaccine that prevents HIV is our best hope.
To succeed, we will need thousands of volunteers for clinical trials, and thousands more will need to support the effort. Together, we can be the generation to end AIDS. Find out how you can help now at bethegeneration.org.
But the Be the Generation websites and materials are only part of the outreach. HIV Vaccine Awareness Day is a big opportunity to highlight HIV vaccine awareness efforts.
One thing we do is we celebrate all past volunteers who have participated in our HIV vaccine clinical trials, not only at the Vaccine Research Center, but around the world. And we also then try to do outreach. We continually do outreach because we really need to always increase awareness about HIV vaccines, because we one day hope to find a vaccine that may prevent HIV infection, but we need to educate the public about the fact that we do not have an HIV vaccine right now.
A vaccine is our best hope for ending the AIDS epidemic, and we need everybody's support.
Garnering support through partnerships with local organizations is one way NIAID and the Vaccine Research Center start dialogues. Sterling Washington is the development assistant at Us Helping Us People into Living, Inc., an organization dedicated to reducing HIV infection in the Black community and providing support services for individuals who are HIV positive. His organization is particularly active on HIV Vaccine Awareness Day.
We are, in addition to getting the word out about the vaccine research efforts, we're going to be holding some information and educational sessions at our headquarters. We're located in the District of Columbia, but do outreach to suburban Maryland, Northern Virginia, and also West Virginia. This morning we went out with the barbershop team, and that is a team that goes out every week or so to local barbershops and delivers condoms and safer sex materials to the barber shops. The barbers in the shops have in large part been trained to be safer sex educators, and they speak with their clients about the need for safer sex methods like condom use. Integrating the vaccine effort into this, we also took information on the Vaccine Research Center and how people could become part of the trials, and it was centered on the African American community, which is underrepresented in a lot of the vaccine studies.
African Americans and Latinos are some of the highest risk populations within the United States for HIV, some of the most affected. And so we want to make sure that the vaccine is being tested among those people that will most need it eventually. And so we want to make sure that that the trials are representative of those populations.
Executive Director at Us Helping Us is Ron Simmons. He explains that there's a history with his organization, the African American community, and the fight against HIV.
It's important for people to be involved in clinical trials so that when whatever results comes out, you know it works for you. The problem is that too often times black people are not involved in clinical trials, and then when the drug comes out, they find that it doesn't work as well with black people. So my feeling is that we've got to be a part of that. So we said, let's train the barbers so that they can be HIV educators, so that when they're working in their shops and they hear something ignorant, they can correct it. In fact, the barbershop program we have now, we teach the barbers to actually initiate the conversation with the guy in the chair. Before it was more or less, if you hear this being said, this is the truth.
People need to understand that A, we need HIV negative volunteers, and B, they're not going to get HIV from the vaccine, and C, the research does not involve intentionally injecting people with HIV.
Dr. Kripke encourages people to learn more about HIV vaccine research and getting informed at the Be the Generation website.
Mostly what we need is for people to participate in clinical trials of vaccine products so that we can test them and move them forward. But there are other ways to get involved. People can learn more about vaccine research, become more informed. One way that they can do that is by visiting the Be the Generation website, which is bethegeneration.org. And also they can, once they do inform themselves about vaccine research, if they think that it's important, then they can educate their friends and family about it. They can be supportive of people who volunteer in trials if they themselves are unable to participate or not interested in participating. They can at least be supportive of others, and that's very important. Also, people can participate in community advisory boards for the research if there's research going on in their areas. And all of our trial sites have community advisory boards that serve as an information link between the community and the researchers and enable the community to better understand the research, as well as the researchers to understand the community perspective and take that into consideration.